like to thank each and every person that is watching or is going to be watching this video. You guys are certainly very busy. You have 1,000 things to do, but yet you took some of your very precious time to watch me do this. So very much, thank you very much for this, and hopefully you will learn a few things about medical training, and you will learn a few things about Ukraine and Eastern Europe in general. So I'm Kevin. I'm currently a 6th year medical student from the medical faculty number 1. It's an English speaking faculty at the National Medical University Alexander Bogomolets in Kyiv, Ukraine. So basically, I've always wanted to record a video since I was in 4th course, just to be able to share my thoughts and impressions and feelings and remarks about my medical training, the one I've been receiving in this university for about 6 years now, and more broadly just about medical training in general. I think this is a good chance for me to do that, and that's the main reason why I decided to make this video. Number 2, I also think that this could serve as just a perfect piece of memory for me to be able to look back at this 15 years or 20 years from now and just think how stupid or how brilliant I was when I was younger, 6th year in Kyiv and in this med school. So it's going to be a great way for me to remember this chapter of my life that is about to close. And just in general, I mean, if you are a 6th year medical student yourself, or a medical professional or a medical worker, watching this could be a good way for you to view another perspective of medical training. If you are a younger medical student, or if you are a high school graduate and you're still considering whether you should go into med school or not, this video could be a way for you to make up your mind. You could eventually get some inspiration or some new ideas or some new methods that you could use to improve your studying process, hopefully. And basically, if you're just family or friend and you're not into medical professions at all, you could just watch this video. You might learn a few things about Ukraine in general and a few interesting facts about medicine. So sit back, relax, listen to what I'm going to say, and watch and just try to have some fun. Basically, that's why I'm doing this video. So that's it. Well, those are a lot of questions you just asked. Well, that's why I actually wrote down a few things here just to help me exactly talk about the things that really matter, not to talk about just a whole bunch of stuff in general. So basically, when I came here, I had to go to a little city in the center of Ukraine called Poltava. That's exactly where I did my preparatory faculty. It was the Poltavan Agrarian Academy. They have very special, very effective prep faculty. I think the results were just amazing. All the students I've been there with are extremely satisfied about the training we received there and the way the language, Ukrainian language, had been taught to us there. So it's a great experience. Now, in general, if you're a high school graduate and you're planning to study abroad, so in a place that is obviously not your country and in a place where they speak a language that is not your own native language, you will eventually have to go through a preparatory faculty. In my case, we had Ukrainian language during the first semester, so first 6 months, and then we had to take scientific subjects. Basically, we had physics, chemistry, biology, computer science. I'm not sure why we have to study computer science, but we had to study that. And we also had a little bit of mathematics at the beginning. So the first semester is a full 6 month based on learning the language and grasping the basics. And the second semester, so second 6 months, is just dedicated at understanding the basic terminology that is required for medical studies in general. So my experience, I have to admit, was fantastic. The first year in preparatory faculty was just amazing. I mean, that was, in my entire life, that year was the year during which I achieved the most. In the prep faculty, I ended up the first student of my entire faculty in Ukrainian language. Then, a few weeks later, there was a regional tournament in Ukrainian language for foreign students that I actually won. And I won that tournament in Ukrainian language on the day that was actually my birthday in June. So that was just amazing. And after winning that tournament, I was invited very graciously by a local TV channel for an interview. I did the interview. Things went perfectly well. They really liked the interview. They even liked it so much that another TV channel saw the first interview and decided to invite me for a second interview. So I basically had the best grades in the whole faculty, won the tournament, and got 2 interviews to fully express myself. And those 2 interviews were dedicated just to Kevin. And so the year was amazing, and my studying process again was relatively well built. Another thing about prep faculty is that you get to grow as a person, as a man. I left my country, I was 18 years old, came here, a completely new country, new culture, new language, and I'm a high school kid. I'm lost. So that year was the chance for me to grow, to know how to organize my time, to know how to become more responsible, to know how to self-manage myself, know what time to go to bed, what time to wake up, what time to study, what time to hang out with friends. So I had the chance to grow as a person during that first year. And if I could give a few advices to those learning languages, if you learn a language, it has to be your number one priority. You have to think in Ukrainian, sleep in Ukrainian, dream in Ukrainian, listen to the radio in Ukrainian, eat in Ukrainian. The language has to consume you. It has to become you. If you want to achieve great results and learn a language and speak it more or less fluently in a short period of time, your entire life has to be about Ukrainian language. So be focused if you want to learn language perfectly. I was lucky because my teacher was just amazing. She knew exactly how to understand my personality and how to motivate me even better. Her name is Lyudmila Ivanivna, and I still, till this day, thank her very much for the amazing job she did. She was amazing, and basically, for me personally, the thing that really drives me and allows me to work even more is if I have challenges. And she was always finding new challenges, inviting us to museums and challenging me to, read that painting, what's written down there, and understand and translate into her native language. Or she would challenge me to read a new book each week. Or she would always think of new ideas to help me, improve fastly with the language. So I thank her very much. Be focused. Think Ukrainian, think in whatever language you want to study, and make sure you have the most practice you can. Get in your dictionary, small pocket dictionary, and try to grasp and cram, 20, 30 new words every day if you can. And make sure you use those new words and have as many dialogues as possible with native speakers. I think if you do those things, you will be able to achieve a great level quickly. So in general, my first year was amazing, just great memories, and yeah, basically that's it for my first year. Well, was it ever my dream to become a doctor? Honestly, the answer is no. It wasn't my dream to become a doctor. Just like many African students or pupils in high school, my dream was to go professionally into sports at a point of my life. I fell in love with basketball. Then I was sure that becoming a basketball player was a really good idea for the future. And then in another point of my life, I read a book from a Senegalese writer. He's Senegal's ex-president, Léopold Sédar Senghor. That book blew my mind up And after reading that book, I wanted to become a writer. So during my final year in high school, my parents very nicely had me sit down and talk to me and said, you know, Kevin, becoming a writer, you can't make a living for yourself, you cannot be financially stable, so that doesn't really make sense, especially in Africa, in a country called Cameroon, you won't be able to survive. So you should think about something more substantial, something more concrete. I was lucky to have good grades in biology and sciences in general, so they suggested medicine, and that's basically the way that the whole idea of medical professions came up. Today, I would say that's probably the best advice or recommendation I've received in my whole life, and yeah, that's the way I got into med school, and basically that's the way I started studying medicine. The important things about first year in med school. Of course, the main subjects. Main subjects in first year of med school, I would say human anatomy, number one, medical biology, up there, second place probably, medical physics, also very important, and bioorganic chemistry. Those four subjects are the most important subjects. Of course, there are other subjects that are also very important. You should pay attention to them, you should study them very seriously, but those four subjects are the most important subjects. Medical physics, it's very similar to the physics that you study in high school and that I studied in high school, so you don't need to really worry about that. It's just about preparing for the lessons, studying the materials that are given to you by your teachers or professors, and showing up in classes and having good grades. Same thing for biochemistry. If you can get someone to help you out with the chemical equations, it's always good. Medical biology becomes much more interesting, and it is somehow much closer to the medical field itself. So you start focusing on microorganisms, you start learning more about parasitology, virology. Well, this is the microbiological aspect of biology. And of course, you start getting to know more about genetics and about heredity. These are really interesting topics that I enjoyed very much. But of course, I would say the king of all subjects in first year is anatomy. So I think that's exactly what I want to talk about more for a first year med student. Human anatomy is just basically the branch of medicine that studies the structure of the organs and systems of the human body. So you're required to have a quite open-minded memory. The people that have the biggest memorization skills are usually very privileged in this subject because they do much well and with less efforts. If you have a visual memory, it's even better because you can memorize all the parts and structures and all the things that you're supposed to know by heart. And also you can see the organs. And usually during the exams, you have a theoretical part with MCQs and open answer questions sometimes. And you have a practical part. So you have an associate professor or a professor, pointing at the stomach or at the liver or at the kidneys and asking you to describe this organ or to recognize this artery or recognize the vein that drains this organ. So if you have a visual memory, if you're able to cram, memorize, and retain by heart all this information and still be able to visualize and recognize these patterns on real organs, anatomy is going to be fun for you. It's very important because during a physical examination in clinical work, you need to know the anatomy quite well because it will help you to recognize the landmarks, palpation of the abdomen, or percussion of the chest, or auscultation of the heart. So these are all manipulations and skills that require a good knowledge of anatomy. So it's really important. Best way I think to study anatomy is to make sure that for each organ you can know and memorize 5 main things, 5 main points or parameters or criteria for each organ of the human body. Number 1, the location. Number 2, the structure. Here, mostly we focused on the macroscopic structure. So how many parts does this organ has, if it has several parts, and so on. Number 3, the surrounding organs. Anteriorly, posteriorly, left lateral, right lateral, superiorly, inferiorly, and so on. Number 4, the vascularization. So which artery supplies this organ and what vein drains this organ. And of course, number 5, the innervation, sympathetic, parasympathetic, and so on. And eventually number 6, the lymphatic drainage is required in your program. So as far as the materials are concerned, the lectures that your professors will deliver will be very helpful. And also, if you can get an anatomy textbook and an anatomy atlas, it's even better. But there are 2 different studying materials. The textbooks actually have words and paragraphs and written stuff that you can read through and understand. An atlas has mostly pictures. You look at the picture, you try to visualize the organ, and you try to understand visually its structure and all the other parameters I talked about. So a good textbook that we used to use during our first year was the Frank Meter Atlas of Anatomy. That's a good one. And as far as textbooks, you can buy any good, thick textbook anatomy that would serve quite effectively as well. So anatomy is the number 1 thing. Another interesting point for first year medical student is try to make sure you get a good studying table, good studying system. Try to organize your time. Again, it's what I talked about when you asked the previous question about prep faculty. Try to make up a timetable. That is not exactly the same as the university's timetable. The personal timetable is different in the sense that you know yourself, you know exactly where you are going to study better and memorize better and be able to achieve more. So try to understand yourself and try to find out exactly what period of the day or the most effective in terms of you studying and memorizing more. So build up a personal timetable and focus on the 4 main subjects I told you about. Try to get good grades in other subjects as well, and hopefully your first year will be good. Mine was quite satisfactory, and it's the base of medicine. First year is very important. The most important things about second year, again, I would say focus on your main subjects. In second year of medical studies, our main subjects were histology, that actually starts during the second semester of the first year and continues up to the end of the first semester of the second year. So that's the 3rd semester. So histology is definitely up there. Physiology, another subject you have to really pay attention to. So the first one, histology, focuses on the tissues that cover up our human body. So you get to learn exactly what does the tissue in your body do exactly, what are those tissues. You get to focus on 4 main types of tissues, which are the muscular tissue, the nervous tissue, the connective tissue, and the epithelial tissue. So you will get to know exactly what covers up your lungs or your respiratory tract or your gastrointestinal system or even your cardiovascular system and so on. So it's really interesting to kind of discover that knowledge, to gain more knowledge about the microscopic structure of your organs. So that's really an interesting subject we had. Physiology is a subject that mainly focuses on function. How do your lungs work? How does your heart work? How does your stomach work and the effect of the gastric juice, of the duodenal secretions, and how does the process of digestion take place, how is urine formed, and basically you get to understand a whole bunch of different mechanisms with the help of physiology. You know, the great topics that I can still remember up till today are the spirometry and lung function tests in pulmonary physiology, or the process of digestion that I talked about in gastrointestinal physiology, or the process of urine formation in urinary physiology, or even the cardiac cycle, which is a major topic in the cardiovascular physiology. So physiology is definitely, I would say, in my opinion, the number one subject in second year that you have to focus on. And of course, you have other important subjects. As usual, you should never neglect any subject. Second year Latin language is also something that is quite relevant, because the medical terminology is based on and originated from Latin language. So the better you know the Latin language, the easier it becomes for you to be able to use all these medical terms in a very simple way. So Latin language is also something you should focus on. Basically, second year, that's it. Maintain the same studying plan, focus on this subject, and everything should go well. My second year was quite good as well, and that's it for second year. Important things about third year: two subjects come up to my mind first. Number one, pathomorphology, and number two, pathophysiology. Those are the two subjects I mostly focused on during my third year. Pathomorphology is super important because that's the key subject to pathologies and to understanding diseases, and of course to being able to work in clinical settings. So pathomorphology will focus on the abnormal structural defects that affect the organs and systems that we previously studied during normal anatomy. Same thing for pathophysiology, disorders and functions affecting the organs that were previously studied during normal physiology. So these two subjects are quite demanding. They're much harder than the subjects that were on the program for second and first year. And personally, I think the pathomorphology, as I recall, was much more stressful for us because we had a great professor or associate professor, I can't remember, Olga Grigorina. She was responsible for teaching us for 2 semesters, and it was really hard. It was very demanding. We were expected to memorize a whole bunch of information in a very short period of time, so memory here is required very much as well. So those 2 subjects in general are the most important subjects in third year. You eventually start learning pharmacology, but this is just traditional pharmacology. So you start understanding exactly what are drugs, how are they manufactured. The main things to focus on in traditional pharmacology are the medical interactions, drug interactions, the indications, contraindications, very important, the therapeutic classes and families of those drugs, and eventually their classification if they have several subgroups. So pharmacology, pathomorphology, and pathophysiology are the most important subjects, I think, in third year of medical studies. Now, fourth year is organized in a slightly different way, at least in my university. Fourth year is very different, first of all, because it's the first year of the second cycle. So the first cycle ends at the end of the third year, where you actually take an exam that assesses the general knowledge you've acquired during your first 3 years. That's the end of the first cycle. And then the second cycle begins with your fourth year. The fourth year in our university is organized into rotations. So now we get to go to hospitals, we get to see real patients, we get to meet real doctors, nurses, and all the medical staff. And it's much more interesting. So in most countries in Eastern Europe, the way they structure studies in fourth year is that we get to spend a specific amount of time in a service, in a department. For example, 1 month in cardiology, and then the next 2-3 weeks in pediatrics, and then another 1 month in neurology, and the next, 2 months in obstetrics and gynecology. So we get to go to different services, stay there for a while, learn as much as we can, and just grasp the most knowledge as we can. We get to improve our clinical skills. We learn how to perform proper medical interviews and ask the right questions to the patient in order to get the most helpful answers. We learn how to perform a physical examination. We practice our skills concerning inspection, palpation, percussion, auscultation, and so on. So the fourth year is really interesting in the sense that we get into the game, into the sphere of medicine and clinical practice. So it's very important. Another thing in fourth year that is quite important in my opinion, I think, is a subject that is called semiotics. That is the study of signs and symptoms. In Eastern European countries, this subject, semiotics, is actually a chapter or a topic under internal medicine. In French-speaking countries and in my home country, Cameroon, it's actually a subject on its own. And I actually agree, looking back at this, I agree that semiotics should be a subject on its own because it's extremely important. I think in order to establish a preliminary diagnosis based on the patient's complaints, based on the signs he presents with, based on the symptoms he exhibits, semiotics is probably the most important subject. So there you get to describe signs and get information that are clinically relevant. If you have a cough, you need to describe the criteria that can help us orient us towards a specific diagnosis. The duration, the rhythm, the tone, the fact, whether it's productive or non-productive, and so on. If you have a pain, you get to describe the 10 or 11 typical criteria of pain. If a patient comes in complaining of vomiting, you get to assess the abundance, the coloration, the time of the day where it's the most intense, the amount of fluid that is lost, and so on. So semiotics is an extremely important subject. If you are fourth year medical student, pay much attention to semiotics. It's super important. And last point is during your summer, if you can attend or go for practical sessions, whether it's in the country where you're studying or in your home country, I would strongly advise you do that. Fourth year, it becomes compulsory. It's no longer a choice, it's no longer optional, it's obligatory. You have to go for practical sessions from your fourth year, actually from your third year upwards. Personally, if I could recommend, I would say that during your first year, at the end of the first year, during your summer practicals, if you can start going into hospitals for practical sessions in nursing care, for example, first year, second year, if you can go for nursing care, that would be great, because no matter what no matter the amount of knowledge you have, no matter what level of study you are in, being in a hospital, watching the nurse work is extremely helpful. First year, second year, nursing care is probably the most important stuff you do. You learn how to give injections, different types of commonly given injections, how to collect complaints on admission of a patient, Eventually, if you are allowed to do so, how to place a drip. So it's extremely important in nursing care. And during the 4th year, that's exactly what the question is about. Practical sessions are extremely important because you start to interact with patients, understand the psychology that is required to address properly a patient and to extract the information you need for your preliminary diagnosis. And of course, you get to perform your physical examination and improve your skills every single day. Auscultating lungs, auscultating the heart, auscultating the peristaltic movements of the bowels, percussing the cardiac dullness or percussing an enlarged liver. These are all skills that are extremely necessary. So I would say focus on your rotations. That's exactly what I did. Work on your semiotics and also go for practical sessions during summer. If you do those things, your 4th year should go just smoothly. Well, I don't think there's much difference in terms of studying plan between 4th year and both 5th and 6th years of studies. The principle remains the same. We go through different rotations. The biggest difference is just the fact that as a 5th or 6th year medical student, you're obviously expected to know more. You should know more and always more. So these 2 years allow you to improve your skills in terms of making correct interpretations of all the paraclinical diagnostics exams that are usually required and used in typical clinical practice. These exams are usually separated into 3 main groups. The number 1 are the structural exams. So all the exams that help us assess the structure of an organ or the morphology of an organ. So these are imaging techniques or medical imaging. These are CT scans, MRIs, simpler methods such as X-ray, ultrasound, and so on. So you're expected to give a proper interpretation of a chest X-ray or of a head CT scan or of an echocardiography or an abdominal ultrasound and so on. So this is the first group of paraclinical exams. The next group would be functional exams, exams that help us assess the function of an organ. These exams are electrocardiography, ECG interpretation, major topic in cardiology and in internal medicine in general. Actually, in any field of medicine, ECG interpretation is required and has to be done properly. Electroencephalography sometimes required, and other functional diagnostic tests such as lung function test, the spirometry, the peak flowmetry in management of asthmatic patients, and so on. And the last group of exams that I would say are much more simple, much simpler to analyze are the laboratory exams. So the complete blood count, blood coagulation test, blood lipid profile, blood glucose index, urine analysis, dipstick, saliva, microscopic, and bacteriology, and so on. So these are the typical exams that are used, and these are the typical exams that 5th and 6th year medical students focus on and try to grasp and know how to assess and interpret correctly. Another important point during the 5th and 6th years of medical studies is the fact that now you go from learning the standard traditional pharmacology to learning the clinical pharmacology. And this is a subject that affects directly your practice and of course your treatment, your management of patients. So now you're not just expected to know the indications and contraindications and side effects of drugs, but you're expected to know their single dose, their presentation, are they tablet forms, capsules, suppositories, and so on, which of them is better for patients' use. You're expected to know the maximal daily doses of drugs, expected to know the maximal duration of treatment under those medications. You're expected to assess the drug interactions, the drugs that inhibit or potentiate the actions of other drugs, to be able to give correct prescription list. So clinical pharmacology is a really fun subject, really interesting, and it's super important for practice, whatever specialty, whatever field it is, it's very important. So clinical pharmacology for the treatment and management part, and diagnostic procedures that are necessary to establish or confirm any diagnosis. So these are the most important points, I would say, in 5th and 6th year. And of course, you keep going from one department to another, you keep understanding exactly what the job of certain specialty is focusing around, and you keep having the chance to make up your mind in the future as to which specialty will eventually rise some interest in you, which specialty will you eventually choose for further specialization. So these are all things that you do in the 5th and 6th year. Yeah. My studying system rests upon 3 main pillars. Number 1 is how can I study effectively? Number 2, when can I study effectively? And number 3, what can I study to make my studying process more effective? So with regards, with the main concern, number 1 is how can I study more effectively? And that depends on each and every individual. Each and every medical student has a proper answer to that. For me, the time of the day that fits me best is studying in the morning. When I study in the morning, I have the feeling that my body and my brain is much fresher, and that allows me to put in much energy and much effort into the work I'm doing without even feeling that. So studying in the morning is something that has always worked quite well for me. Now, what to study is something that depends on your year of study, obviously, and on the subjects that you enjoy studying the most. Obviously, there's a large, very wide variety of medical literature, a lot of textbooks, a lot of documents, a lot of PDF files that you could find on the internet or even buy in medical libraries. So it's up to you to find the textbooks that are the simplest and easiest to read, and the textbooks that are very well explained and that you could actually read and grasp the main substance about all the information in a very simple way. So for me personally, I do have a whole bunch of textbooks that I actually identified as being quite simple and quite easily understandable. It's up to you to do the same selecting process and just to pick the textbook that are quite straightforward and easily approachable. And of course, how to study is something that depends on your type of memory. I do have a written memory, which means after I read a text, it's important for me to rewrite the main points, the key informations from that text on a blank piece of paper, and that's a step that assures me and lets me know that I really understood what the chapter or what the topic is about. It's an important step for me, and it's something that I have to do to be able to retain these informations for a much longer period of time. I know a lot of colleagues or other medical students that have a vocal type of memory, so it's very important for them as they read and study to say out loud all the information that they have memorized and gotten from the text. That way, they believe the brain or their brain absorbs these informations much faster. That's a vocal memory. And others even have a visual type of memory, which means reading theoretical written information in a textbook is something that is quite abstract and not very concrete to them. And the good thing is that with all the multimedia of or generation, it's even easier to study in such a way, because on YouTube, on Dailymotion, you can actually access a whole bunch of medical literature. Most important topics are actually available on YouTube or Dailymotion. So even if you have visual memory, you can watch several videos pertaining to different medical topics and be able to take part in a lecture that is delivered online on YouTube, or watched other videos that explain, that illustrate in a visual fashion the topic that you're studying. So all three types of memories are good. It's up to you once again to identify what type of memory you do have, and to be able to study effectively and stimulate that type of memory in your studying process. So I think it's something that takes quite some time to be able to understand yourself and to be able to understand your skills. Once you understood those main things, your studying process will become much smoother and much easier to maintain, because in medicine it's very important to study effectively, and also of course to study regularly. Repetition is the mother of all sciences, and repetition is the best way to memorize large amounts of information for a long period of times. So my studying system was quite effective in such a way that I was most of the time able to remember information that I'd gotten from second, third, or even fourth courses. And that's all about the studying process. So that's basically what I can say about that. My studying system has evolved once, and I think that was during the transition from the end of the first cycle, that's the third year, to the beginning of the second cycle, that's the fourth year. And I think the reason for that is because during the first cycle, you are mostly studying to obtain good results, to get good grades, good marks. So the primary goal of your study is you getting a good score during the exam or the test. Whereas in the second cycle, the settings change. It's more a clinically based setting. So you're no longer studying for a specific test. You're studying to be able to be effective in your clinical work, to be able to help efficiently a 6-year-old child who presents with fever, repeated vomiting, loss of weight, and an altered general condition. You're no longer studying to be able to pass the pediatric exam only, but you're also studying to be able to provide the most effective medical care you can to this boy and to his family. And the same example could apply in any specialty. The main idea is that in the first cycle, you're studying to be able to pass the final exam. Whereas during the second part of your medical training, you're mostly studying to be able to just be a good doctor, be a good medical practitioner, be able to establish the correct diagnosis, and be able to provide the correct therapeutical or medical or surgical treatment. So that the goals and the objectives are different, and I think that's something that every medical student has experienced at a point during his or her training course. So yes, my studying process has evolved in that sense during the transition from first cycle to second cycle. That was the only time, as I recall, and I think it's a natural evolution that each medical student has to take. Yeah. One thing both groups of specialties have in common is that the primary goal remains the same: to improve the patient's quality of life. Whether it's a surgical specialty or a medical specialty, the goal is still to provide the best possible care to the patient. Surgical specialties are challenging in the sense that they do not only require an excellent intellectual medical training, but they also require good skills when working with your hands. And also they require the surgeon to be physically fit, because she's expected to be standing for long periods of times in an OR. So these are all skills that are compulsory for a practitioner to be able to perform well as a surgeon. Now, medical specialties, I believe, are more interesting because they have a deeper and broader effect and impact on the patient's health. Medical specialties also require an extremely good knowledge of diagnostic procedures. They require good skills in terms of treatment. They require good knowledge of all the prophylactic measures and being good with prevention in general of all these pathologies. And more importantly, they require a good knowledge of monitoring and following up all the typical conditions involved in medical specialties. These are usually conditions that are lifelong and that patients live with for the rest of their lives until they die. So the impact that is expected in case of medical specialties is much broader and much longer than the impact that is usually provided in case of surgical specialties. So personally, I'm definitely much more interested in medical specialties, and I see myself going into medical specialty in the future. Well, the next biggest challenge will be the medical internship. I can't wait to be there already. It's an extremely important step, and it's something that is extremely important for me personally because I get the chance to work as an intern. I get the opportunity to take much bigger and much more important responsibilities in the diagnostic process and in the medical care that's provided to patients. So it's the chance for me to gain much more experience. It's the chance for me to learn much more with patients presenting with different conditions, different pathologies, regarding different specialties. So it's a chance for me to gain and acquire a broader view, a broader perspective of the entire medical field or entire medical specialties in general. So working as an intern involves me rotating from the internal medicine service to the obstetrics and gynecology, and then to the pediatric department, and then to the surgical department, and so on. So I encounter different clinical cases. I get to work with so many diverse pathologies, and I get to acquire much more experience rapidly, and more importantly, I get the basic skills and the basic important reflexes to have in managing all typical conditions regardless of the specialties. So the internship, which I hope will last 2 years, is an extremely important step, especially coming from 6 years of medical training. I think it's important to go through the internship first before enrolling into whatever specialty I am interested in, or any medical student might be interested in. Medical internship is an important process to undergo because it will ultimately allow me to be very polyvalent and to be able to manage most of the typically encountered medical conditions more or less effectively, or at least to have the good reflexes and to be able to quickly orient those patients to the required specialists. So it's an extremely important step. It's the next challenge, and hopefully it will go well. Well, the things that I'm the most proud of so far, I would say first of all, reaching this level. 6th year of medical training. It's almost the end of my general medical education, so I'm extremely proud to have reached this level. I obviously worked hard for it to happen. I made a lot of sacrifices for it to happen, but generally I'm very proud that it's finally becoming a real, true event. I am going to graduate from medical school, hopefully if I pass the final exams, which I am very confident I will. And generally, to have had the chance to learn so much about the human body and to have had the chance to provide medical care is something I'm extremely proud of. On a non-medical perspective, I'm very proud that I've had the chance to learn a lot of different languages. Russian and Ukrainian are definitely the two latest languages I've learned. And I'm also proud that I've had the chance to acquire a relatively good command of medical terminologies in both Russian and Ukrainian, and also in French and in English. So these are things that I've done that I'm quite proud of, and hopefully in the future this is something that will allow me to work in different clinical settings with different patients and to be able to communicate in multiple languages. So yes, I'm very proud of that as well. And in general, I think I met a lot of different people. I got acquainted with different cultures. I was able to exchange with people from different places of the world, and that's something that I'm extremely proud of as well. I'm very privileged to have had the opportunity to exchange and to be around people with so many different characters, behaviors, personalities, religions, cultures, and so on. So it's definitely something I will remember positively and something that I'm very proud of. Well, there are probably 1,000 of advices I would love to share with you, but in my opinion, the three most important things and the three best advices I could give would be: number one, be sure that medical studies is exactly what you want. Now, you may not be exactly sure at the end of your high school education, and I wasn't sure at the end of my high school education. My parents made the initial decision, but I had 1 year in medical school to be able to understand whether this was what I wanted or not. You might have a year to figure out that question and to understand whether it's something you really want or not as well. So be sure that medical training is what you want, because it's a long-lasting process. It's 6 years of general medicine. It's almost the same duration, or sometimes even longer, for specialization. So be sure that's what you want. Number two, be focused. Once you've made up your mind, once you've made your decision, you want to study medicine, you want to become a doctor, later on a specialist, be focused on your studies. Be focused on the work you have to do. It's a difficult task, it's a long task, but it's something that's definitely achievable if you are focused and if you dedicate enough time and effort and energy into that process. Be focused. And number three, be persistent. There will be setbacks, there will be failures, there will be times during which nurses, doctors, or specialists, or medical staff will not be satisfied with your work, will expect much more from you. But being persistent is the one thing that will allow you to go back home, work even more, study even more, come back the next day, and try to prove yourself as able to do the job, as willing to do the job, and as efficient at working as a medical professional. So be persistent, do not lose hope, do not lose faith, keep working hard, and keep doing as best as you can. So 3 main advices: be sure, be focused, be persistent. Yes, definitely. First of all, my family. These are my father, my mother, my older sister, my younger brother, and my younger sister. These 5 people have always been there for me. They've always been present every step of the way. They've always supported me financially, emotionally, spiritually, in every single aspect of my life. So there's no imaginable way I could express my gratitude to them, just using simple words and telling them how much they mean to me and how much I am grateful to their support and to the fact that they've always been there for me. Also, I think it's important to thank my teachers, all the teachers that have had me from the first day in this university, my first day in this university, up to the last day, to the end of my 6th year. Thanking them is extremely important. It's something that I do very sincerely. So thank you to all of my teachers for being there and for allowing me and teaching me and helping me to grow as a medical student and in the future as a medical professional. And also, I have very special and very warm thoughts for my group mates, all the members of the group number 13 of the medical faculty number 1. Thank you very much for being there. Thank you very much for being part of this journey, of this adventure, and just in general, thank you for allowing me to be part of this extraordinary group, I would say, and there's no exaggeration. I really believe that our group was a solid group. We all were able to support each other, and so I would like to thank every single member of that group as well. And thank you for watching. Thank you for taking some of your time to listen to all the things I just explained, and basically I think those are all the people I wanted to thank.